Welcome to the T-Level Health Core Assessment Employer Set Project overview. In this presentation, we'll provide you with essential information about the ESP, its aims, assessment objectives and core skills. Please remember that the information provided here is based on data available as of September 23 and may not reflect future changes to guidance documents. Always refer to the most up-to-date guidance. So let's begin with the aims of the ESP. The Employer Set project is designed to help students plan and complete tasks within the Employer Set project, review and reflect on how they've approached the tasks in relation to meeting the brief, use appropriate English, maths and digital skills, apply mathematical competencies in relation to observations and assessments, utilise written communication to submit an extended piece of writing using correct terminology, spelling, punctuation and grammar. Demonstrate how to use appropriate verbal communication skills and present information to an appropriate audience. So let's start with an overview of the ESP. The ESP is an externally set and marked assessment that offers a choice of 5 briefs, each contextualised to specific occupational specialisms. These briefs are released to providers 7 working days prior to the assessment window, and students can have access to the assessment material when the window begins. The ESP serves as an opportunity for students to apply core knowledge and core skills. Now let's delve into the assessment objectives and their weightings. So there are 5 assessment objectives for the Employer Set project, and these range from an 8% to 56% weighting, as with the higher of 56% on the AO2, which is the application of core knowledge as appropriate and the core skills. The ESP assesses various core skills that are essential in the health sector. There are 6 core skills that demonstrate person-centered care, communication, team working, reflective evaluation, researching and presenting. The tasks in the ESP vary in duration, ranging from 2 hours to 3.5 hours, with a total Employer Set project time of 18.5 hours. Each task is designed to demonstrate different core skills, core knowledge and general competency framework. In the preparation research tasks, students will act as a supporting health worker within a multidisciplinary care team. This is following one individual's healthcare journey. This task takes place under supervised conditions during a 2-week assessment window with a 2 hours duration time. Students will have access to their pre-release briefs and access to the internet. They also have access to any other relevant resources such as textbooks and notes taken throughout the year. Evidence should be four pages, excluding references to help support tasks such as their work process synthesis report on supporting the individual. Where permitted, for each task, a copy of evidence produced by students in early tasks must be provided to students by either electronic or paper means. When appropriate evidence provided to students must be destroyed and must not be included with or replace the original evidence generated and submitted by students during the respective task. Providing copies of previous generated evidence for a subsequent task is not an opportunity for students to amend or approve previously submitted evidence, and any additional notes that students wish to include must be made separately from copies of the previously submitted evidence. So let's reflect on the Summer 23 series of the ESP, and several key themes emerged overall. There was increased standard and provider effort. This series demonstrated an improved standard across all tasks, with providers putting in significant effort to deliver content and support students. This support contributed to students successfully performing in the ESP. Students displayed a clear comprehension of their role within the project and made logical choices in selecting clients for their project. While the overall standard increased, some students lost marks due to not paying sufficient attention to task requirements, utilising NCFE's provided materials, including mark banding information and indicative content, is recommended for better task understanding and completion. Using NCFE's provided performance for tasks were advised, and if centres used their own formats, ensuring all necessary sections were included was crucial to prevent missing information. Recording equipment quality and suitable environment for audio-visual tasks were emphasised for accurate representation. Issues arose with tasks conducted in noisy environments with other students conducting the same task within hearing range. Providers should ensure that students have a suitable distraction-free environment for these tasks. For task 3B, involving presentations, this showed that providers should ask questions that support students in elaborating on points made or clarifying information. Careful consideration of the questions posed to students was highlighted, especially to avoid undue pressure. Several examples show problems with recording equipment and incomplete evidence submissions. Providers were encouraged to name files accurately and use students' registered names for consistency. Timely submission and open communication with NCFE were emphasised. In summary, the Health Core ESP showcased improvements in student performance and provider effects. Students demonstrated a clear understanding of their role and logic client selection. Attention to task requirements, effective evidence creation, suitable environments for audiovisual tasks, thoughtful question, and accurate evidence submission were all essential for successful completion of the ESP. For additional support, make sure to access key documents like student exemplar, materials, core skills, tutor guidance, and the specification. Our YouTube channel and events and webinar page offer valuable resources. We also have a designated support area highlighting key resources to aid teachers and students. Thank you for watching. We wish you success in the T-Level Health Core Assessment Employer Set project.